young lady. So she was referred for an orthodontic, premolar extraction. Somebody injected and she was not feeling well. Manage and take blood pressure. तो शी सेलिंग सर नहीं मिलता है, डायस्टोलिक नहीं मिल रहा है. आई टोल्ड सिस्टर आप लीजिए. तो शी इज टेलिंग सर वाइड ब्लड प्रेशर है, डायस्टोलिक नहीं मिल रहा है. इंटर्न हैज़ टू अंडरगो CPCR ट्रेनिंग which is very serious and meaningful, right? Antibiotics, very 10th standard girl, good looking, appearing for exam. And then gradually, so palatal necrosis, bone, there was a oronasal fistula. One thing which many may not know, there is this Maharashtra State Dental Council. They say you have to undergo 2 lectures per year. It's on record, it's printed. One is on medical emergencies and one is on basic life support to renew your license.
But also, as you said, we need a witness signature. So if no one has come along with the patient, can your staff also be a witness and sign that? People who have stents and they have heavy ecosprints and blood thinners going on, antiplatelet drugs. So I want to know the recent protocol, whatever is going on recently.
Tell them what I'm going to tell, then tell them what you have told.
Yeah.
It's a famous saying by Stephen King. There is no harm in hoping for the best as long as you are prepared for the worst. In dentistry, medical emergencies are least foreseen. So if you have ever been trained for medical emergencies in dentistry, there is a 90% of the chance that it has been under this respected gentleman. Let's welcome Dr. Hemant Dhusia.
Hello, sir. Welcome to the podcast.
Thank you, madam. God bless you.
Thank you so much, sir. How are you doing, sir?
I'm well. How are you doing?
Good, sir. How's your day been till now?
Till fantastic, and thanks for having me. And looking forward to an exciting session.
Yes, sir. Me too, sir. So, sir, let's just start from the beginning. That why do you have the same story that MBBS nahi mila and that's why BDS was the option, or you have some interesting fact for us?
No, 100%. See, all of us. I belonged to an era where it was always medicine only.
Okay.
My problem was my elder brother. He was doing MBBS KM Hospital.
Okay.
World's best, And then there would be this comparison. I got into dentistry, I'm frustrated. Then they would compare and they would ask me, I'm being very honest, Tera kitna mahine ka diploma? Then I would say, no diploma, it's degree 4 years. So they will ask me, kitna mahine ka ek dant sikh padta hai tum log? All those things. And I had 2 more problems. My brother told me, see, this is not simple. It's going to be very difficult, number 1. And, when I joined dental school, my father had retired. So, madam, I had only 2 aims in life for all those 4 years. One is to pass in the first attempt and get a naukri. But let me tell you, that time jobs were very simple. They were ample, they were available. People would not take. So it was like that, And I'll take my journey further. So when I entered dental school, we were okay because we had no choice. Then when we were in 3rd year BD, I'll tell you, we had fantastic teachers. They were very strict. And, for example, the JJ teachers would come to GDC to teach. And they would always, surgery, medicine, they would always tell us, go to the casualty, that is St. George's. Next door, go and see, learn. So when we were in 3rd, when I say we, our class, and I had a very close friend called Dr. Vipkar. So when 3rd year BDS, clinical posting, so we went in the theatre. So, when we went and see, so 3rd year BDS, so theatre and then OT table and those scrub suits, very serious. And then, we realized the PG students were doing something on the oral end. And Kanna sir was doing something on the hip bone. So, then we realized he's hammering something. I'm being very honest. And my friend Dr. Thakkar is telling me, ye patient abhi marega shayad. So we didn't know what's happening. So we asked somebody called, taking names because I can, so he told me, no, we are doing a case where we require a bone graft. So sir is harvesting a iliacrest bone graft. Now that was the time I thought this is the branch that will take me near to my brother and could be the medical people. So that was the interest. And next week, I was sitting in the library reading, and one, we call it Mama, the peon comes from St. George's. He wanted to know where is this one Dr. Parvez sitting. He was the PG. So I told him he's there. So this Dr. Shaukat Paisal, you come along with me. So he took me to the St. George's Hospital, now dental college and St. George's. So it was hospital, then ward and admitted patients. Then he went, sat with them great style me on the sister's chamber, looking at X-ray. And then there was a patient, bandage here, bleeding. He said, this is a fracture mandible. And he started bleeding. So I said, no, abhi to ye karna hi hai. Because that was, so that, those two things brought me, so
very
that was very close to surgery.
Wow, sir, wow. That's an interest, like you were inspired basically.
Yes, very much.
And it was pure inspiration.
Yes, and somehow it's not that I didn't like radiology or prosthetics, but this was, and all of us that time, believe me, I remember we had Professor Dudani sir, he was our HOD. And very first day he came to the class, third day BJ class, he said, how many want to do oral surgery? All of us were, putting a hand. And he was, of course, yes, so many bright faces, So the chabi lag gaya, my HOD thinks I can do. So, of course, I did my BDS first shot. And then naukri, as I said. So I got, not jobs are very easy, but you'll say I'm kaka fake, right? My first job was part-time dental surgeon, EDC, evening dental clinic. So my pay was 245 rupees. Then I got promoted. Part-time lecturer, periodontology for the dental mechanics. So 275. And then gradually I became a dental surgeon. Now there I was posted in special surgery. We would treat all the VIPs. You can name them, they were there. Now my dean that time was Dr. V.M. Desai, who's a god for me. I need to take two names. Dr. Desai there, he was our dean, then he became a joint director, medical education and research. He was, because of him, I'm sitting here for sure. And since we're talking, I'll take one more name, Dr. Snehalata Deshmukh madam, she was our dean, then she became vice chancellor, Bombay University. Great. We just lost her last month. So these two people, because of them. And so then I became a lecturer and then associate professor. Then I came to Sion Hospital. There, my vision expanded. I'll talk about it further. And of course, I joined as an associate professor and ended up as Dean Academics of LTM Medical College. So, no, nothing. It was pure luck and blessings. So that was my journey.
Beautiful, sir. Beautiful. So this, you have a special inclination, I would say, to medical emergencies in dentistry. So what was that experience or what was that point where you realized, okay, fine, this is what you want to do?
I was the first associate professor in medicine in municipal corporation hospitals, medical colleges. And, see, all of us, oral surgeons, we walk 4 feet above the ground, both hawa mein rehte hain. So I was there. AP and HOD of department, and routine chal raha tha. And then there was this young lady. She was referred. Next door we have this thing, Lions Club Clinic. So she was referred for an orthodontic, premolar extraction, and somebody injected and she was not feeling well. So so and how? So हमारे GDC क्या first thing, lower the chair. Number one. Then ठीक है. Second thing, sprinkle water, and mist, we didn't have, ammonia tincture. So not feeling well, So, अभी मैं HOD, so I said, so इसको बोला, चिल्लाया उसको, houseman, ये आता नहीं, वो आता नहीं, किधर से सीखा, किसने सिखाया? Then I said, okay, AP को, lecturer को बोला, manage and take blood pressure. तो शी सेलिंग सर नहीं मिलता है, डायस्टोलिक नहीं मिल रहा है. अगेन आई हैड चला, तुम लोगों को आता भी नहीं है, बीपी लेने आता नहीं है, वर्किंग इन अ मेडिकल कॉलेज. देन आई टोल्ड, बट व्हेन यू अ लिटिल फील यू आर स्मार्ट. सो आई थॉट गड़बड़ हो सकता. लेक्चर वाज ऑन ओरल सर्जन. तो आई टोल्ड सिस्टर आप लीजिए. तो शी इज टेलिंग सर वाइड ब्लड प्रेशर है, डायस्टोलिक नहीं मिल रहा है. So now, so abhi sab khatam hai, because dentistry, you're in a well, I'm being very honest, in dental college. And of course, we had seniors, we had Professor Khanna, Muthe sir, my teacher Dr. Vadkar, Khali sir ko, they would come and manage. Abhi kya karne ka? So, but Sion Hospital. So we called somebody from medicine. This young boy comes in, junior JR3, JR1. He came and said, भाई क्या होते हैं भाई. He said, एक काम करा, जोरात श्वास घेऊ नका, हळू करा. And he said, paper bag है क्या? I'm telling you. He put the bag and then she said, hadu, and then she was fine. And then he said, she's hyperventilating. And I was thinking of starting oxygen also. So that time I realized it is not simple. There is something, because I was so this thing that syncope means we are the best. Dentist, anyone can, but that was not syncope at all. And I had in mind almost to tell them we'll start oxygen. So I said, abhi to gadbad hai, seekhna padega. And then slowly I realized, see, GDC theatre was scalp veins. Sign, everything was IV cannula, intracats. Everything there was X-ray. Here everything was CT scan. So I thought, abhi, either you learn. So slowly there was one Dr. Arun Sheth. He was plastic surgeon. He taught me CT scans. And then there is one PG student. He's a big man now, professor. He was doing a thesis on CT scans and X-rays. So he would come to science. So I learned, and then gradually learned to take. And then slowly, I realized it is not simple. It's a big world, and you need to learn. So every time there would be a patient, I would read his file carefully, history and what dawa kya de and what dosages. Slowly, because what would happen, GDC was train sutro, bhago, oral surgery, max syncope हुआ, कुछ नहीं होता. Here, आप चल रहे हैं. Say you have entered the Sion Hospital gate, and from the gate till your building, there will be somebody on a stretcher and some house officer holding an ambu bag, patient intubated. So I thought, yes, abhi karna pad, ya to 6 or do or die. And then my brother was there, so slowly, and I had great teachers. One thing I'll tell you, my experience, I may be totally wrong. Medical people are very nice. They embrace you, they teach you, they never make you feel that you don't know. Ulta dentistry mein tha. So all love I've got is from medical people. And you name the person and they, For example, we were doing a cyst, extraoral. So, and I was injecting LA adrenaline. So Dr. Sir, HOD plastic, big man, big man. He said, काय करतो रे? अपना स्टाइल ऑफ ये नॉलेज बताया. सर एल एड्रेनलिन डिफाइनिंग टिश्यू प्लेन्स hemostasis. He said, "But सांगतो story सांगतो." He said, "I was doing a PyoSeal in nursing home." So I told the anesthetist, "Please give gentamicin." And then BP gone down, bradycardia, pulse going down. So then he said, we realized probably that person was allergic to gentamicin. So he said, "ये काय को करता है? Why lignocaine?" So from that day, madam, I learned that no, it should be saline and adrenaline rather than LA. So those things I started learning slowly. It took time, but and they were very nice. They were there to teach and never criticize. He never criticized. Actually, itna bhi malum nahi. And sir was always told story sangto hai. And then he was nicely tell you what was the thing to be done.
So they had a learning process basically.
Yes. I have one more thing to say. So he had basically his nephew, Dr. Mukund, another big man. He is big hand surgeon, big man. Me the second, third friend, because we would work with plastic. See, Sion was plastic, maxillofacial plastic on Wednesdays, OPD, and oculoplastic on Fridays. So I made show the Kanekana. So I was telling Mukund, I'll tell you, now there was this girl, GDC, she injected formalin instead of LA palatally in a child. And then they realized, what would happen that time? They would keep formalin in LA bottles. So she had aspirated. And so, gadbad, something goes wrong. So oral, they came, my boss was not there. So I was a senior boss. I said, abhi kuch karne ka nahi, just give steroids, antibiotics. Very 10th standard girl, good looking, appearing for exam. And then gradually, so palatal necrosis, bone, there was a oronasal fistula. So we repaired that using a double flap. Good results. So I was showing off. So I was telling Dr. Mukund, see, I did this local anesthesia, beautiful result. Huh? He's telling, oh, very nice. He said, I think 2-3 things come to my mind. He said, you have done under local. So, and typical, what we do, we have the draw sheet, aankh band ho rata hai. He said, ki I was wondering, जर तो clot जाऊन बसला on the vocal cords. So unless you see the blood getting dark, how would you know that there is a respiratory compromise? I realized, Baba, बहुत सीखना है, एकदम गड़े. And he's telling कि हाँ, actually you had this thing, no, Mackles, in case to get the. I said, मेरे को तो मालूम भी नहीं था कि that clot can run down the throat or pharynx, block the airway. तो slowly learn किया, बड़ा बात करना बंद किया, and it was like this. So, but if you have the inclination, and you should learn.
Yes.
Once you are ready to learn, everything is nice.
So this is where you had an experience in surgery. But I want to ask that any dentist, agar after BDS, if I plan to open up my clinic, what stage I should be prepared for the worst? So as they say that, expect the best, कि patient को कुछ नहीं होगा, but be prepared for the worst. So what do you think that according to general dentistry, who are doing general dentistry and opening up a clinic, what is the correct stage to learn this topic, medical emergencies in dentistry?
To my mind, the best time is to learn from the third year BDS theory classes. Okay. And I think, I don't know, I'm not sure, but I was in medical college. So we have this something called as CBME, competency-based medical education now. So and of course they have integrated teaching now, starting this 24. So what's happening, they start teaching in third year MB, or now they say phase 3, part 1, all these things. And compulsorily every intern has to undergo a CPCR training, which is very serious and meaningful. Okay. So third year BDS and surgery, medicine, and once we become an intern, the CPCR should be taught. And CPCR should be with the lecture on medical emergencies. Yeah. For example, you may talk on cardiac arrest, angina, and then once it goes further, then I'll come and do a CPCR. So it should be third year BDS, continuous learning. And we would go to these injuries. Samko masti bahut. All of my friends to see cases. They would tell, our teachers would insist. Student, probably you ask anybody, I talk to a lot of dental students, no one wants to do surgery at all. बोले पागल 7-8 घंटा ऑपरेशन करना, पैसा मिलता नहीं है, हॉस्पिटल अटैचमेंट मिलता नहीं है, why not do endo? But I'll tell you, endo, somebody, now you'll tell me, मैं पूरा आज फेंकता हूँ, I know a prosthodontist, wife is a pulmonologist, so she's MCH of pulmonology. So he is telling in front of her, I am prosthodontist, तो मेरे को कभी आएगा नहीं. अरे but madam, one patient maybe, say hyperthyroid, you stick a needle and that could be an emergency. तो ऐसा कुछ नहीं है. And so third year, final year internship में CPCR, and keep on getting exposed. Yeah. See, because what they say, books what they'll say, you have to have that suspicion, but unless you see, how will you learn? That's number one. And then, since I am a teacher also, only study, there is no Indian study by Malamed and Fast. Malamed Guru. Guru I, because when he had come to WD, I had so Malamed, everyone got. Now they have done a study where 10 years study, they have interviewed 30,000 dentists and around 4,000 emergencies reported. So when they extrapolated, it was for a dentist, in his entire life, he will see 7.2% emergencies. And again, most of them here will be syncope only. So, but you have to be prepared. Because, as someone said, ki all of us cross roads, one of us may get hit, for you and me and my family 100%. So that one emergency can, and it changes. I'll tell you, this young couple in Pune, that everyone knows. So they lost a child, patient, and then they had a tough time. People talk, and then media. Yeah. So all those things happen.
Yeah.
Should be ready.
Even this one of the cases that recently came out, that groom was doing an aesthetic procedure and died on the table, and that so you never know. Like any procedure can be
exactly anyone. All of us are crossing roads, and why not? And patients, I'll tell you. They don't give अपनी हिस्ट्री अपना देते नहीं अच्छे से, because you ask no blood pressure, they laugh at you. जैसे तुमको क्या करना है, तुम दांत का डॉक्टर है. So even eliciting history is a big art now. but then we need to learn slowly हो जाता है.
Yes, so in US when I was there, they give us a card. So if you are a medical practitioner, they give out a card where they tell you that the basic training, the basic life support training, BLS training that you've done is valid for only 2 years. After every 2 years, you are supposed to get the training again. You'll again get a card which is valid for 2 years. And your license is only valid when you have that card which is meant for 2 years. So I think even that will, encourage you कि every 2 years वो training करना है. And it is just a revision and also a reminder that you should be careful.
And they keep on revising. And
Yes.
See, for example, every 10 years they meet. So 2020 BLS was different. Now I'll take you, a little back. So I joined Sion Hospital, and then there was this. They formed a CPCR committee. I was there. So now Sion Hospital certificate is valid abroad also for 2 years. So 1994, I started the first ever CPCR workshop at Sion. Big hit हुआ. And then onwards we started doing. So I'll come back to your point. AHA, American Heart Association. For example, there's there's an organization called Life Supporters. So they conduct AHA courses. Holy Spirit, Bandra, so many. So very important, because not only abroad. See, why these children would come, they realize, because most of them wanted to go abroad. So they wanted a certificate. It's going to be very costly there. But something happens to my patient tomorrow, God forbid, if I have a certificate that I was trained in BLS, मैं तो बच जाऊँगा. So it is very important. We must have done around 67 such this thing in Sion, IDA and this thing. And it needs to be taken forward. And of course, so many are doing. Now, MGM guys are doing. They have 3 professors trained in, ACLS, BLS, AHA. People are doing. So it's very, and then you are right, it should be done here also. I'll tell you one thing which many may not know. There is this Maharashtra State Dental Council. They say you have to undergo 2 lectures per year. It's on record, it's printed. One is on medical emergencies and one is on basic life support to renew your license. So it is there. So MSDC is there. So that's why also, because a lot of people who speak on medical emergencies, for those courses, lectures, the MSDC gives money.
Oh,
yeah.
Okay.
So they will give you money, you can go, and entire state. So things are slowly moving on, but then like abroad, maybe a day will come, everyone here will have to be licensed. Very important.
True. So as a BDS, if the patient is coming in, as you said that history taking is very important. So what are the facts that we need to take care, while we are recording the history of the patient?
See what happens. If you take a good history, they say, listen to the patient, he's giving you the diagnosis. Now, history taking में क्या है? Blood pressure, diabetes, hypertension और ऐसा नहीं. The best thing is, to make a format where you have, say, cardiac disease, respiratory, this, and finally any other. Because what happens, they will say, yeah, आपने पूछा लेकिन मेरे को ये था ही नहीं. One thing. And be very serious, give time. And because that will give you, how the patient is. And then they say weigh the patient ka procedure and the risk that may be foreseen. See, oral surgery simple hai. We have this, we send to the anesthetist. So there is that ASA classification. हम लोग simple बोलते हैं 1, 2 करने का, बाकी नहीं करने का. So send to hospital. History. So I tell everybody, पूरा chart करो. How to chart now? I love Bappi Lahiri songs. 5-6 book का उठाने का, this card, and then keep on adding and have your own.
Okay.
So, like for example, AOMSI, we have our own cards, but one should make. And then finally, what's the important Medico-Legal is the patient will sign, have a witness signature also. वो पलट सकता है कि मेरे को मैंने जैसे जल्दी किया है. But you should at least, no, this is not, consent is required. When you take a consent, you have to take 2 signatures, but इधर भी ले लेने का, because वो पलट जाते हैं, ऐसा है. एंड बिकॉज दे स्टार्ट विद कि ये तो दांत का ही डॉक्टर है, इसको ये सब क्या करना है, तुमको दांत निकालना है ना, तो डायबिटीज से आपको क्या लेने देना है. फिर हम लोग डराते थे साइन में कि ब्लड प्रेशर है ना, आपको लगता है हम नस फटेगा ना इधर, लकवा मारा, देन दे से नहीं ऐसा है ना, देन दे अभी फिर वो दवा निकाल के दिखाया प्लास्टिक में से 15-20 गोली. So you should have they would tell all our teachers, take history, patient is given, we would not, but history and then weigh the procedure and the likelihood of complication, and then see करना है कि नहीं करना है. See, I had a friend, he would say, 5,000 के लिए मुझे 5 लाख का मगजमारी नहीं चाहिए. It's important in today's, I'm telling you.
True.
Because
if the patient has anything, that is going to be more expensive rather than right now taking history and giving time to that.
And mental stress, kitna rehta hai, madam? Today, see, not people have stopped doing so many. Two of my oral surgery friends, they have stopped local giving LA at all. But my age, खाली बात करने का, दवा लिख के पैसा लेने का. It's like that. But why? That should never happen. Yeah. So history, detailed history, and then like they said, after some time you realize ये झूठ बोल रहा है कि नहीं. Then start with the closed-ended questions. Yes. So they come around. Yeah. It takes time. Yeah. That's why they say have to work with a senior person and how they talk.
So if at all, sir, as you said, we need a witness signature. So if no one has come along with the patient, can your staff also be a witness and sign that?
So I'll repeat again.
Yeah.
Witness's signature in history chart is not at all mandatory or compulsory. But if you take this, I'll give the answer. But if you're taking a consent, consent will talk later. What they say, consent should be in a language that the patient understands. Yes. Okay. So what will happen now? I am speaking Marathi. I don't understand Hindi at all. So when I'm telling in Hindi, there's a person sitting there. Mostly it should be relative. We call it sage wala. So what will happen? I have signed. He's signing because in front of me, this doctor has explained, this is one ho gaya. So who can sign? Best is relative. Yeah. Always. Because tomorrow doctor to tumhara side lega hi. If not, your assistant. If not, even you can sign. Okay. Yeah. Okay. But it has to be. Okay. But by and large, see, for example, हम तो दांत भी नहीं निकालते without सगे वाला. अच्छा. Yeah. वो time सब चले गया. In good faith कुछ नहीं कर सकते.
Okay. Better there is someone.
Yeah. छुपाते हैं. I don't know. I'm thinking my sign. No. अभी हमने on the lighter side, हाउसमैन ने केस लिया. सिस्ट था 3rd molar के पास. He wanted to operate. And then history, so that lady would not talk only. ऐसे लोग पर्दा लेके बैठे थे ना. She would not talk. क्या है? So then her husband came. And by the time he was scrubbing, तो बोला अरे कुछ ऐसा है क्या तकलीफ? बोला ऐसा कुछ नहीं, लेकिन she is 3 months pregnant. तो वो बोल रही है उसको, तुमको समझता है क्या, बच्चा गिर भी सकते हैं ना, तो जो आप करो, बिकॉज हमको वैसे भी बच्चा गिराना था. सो जोक्स नहीं है, तो ऐसे लोग भी आते हैं, दे जस्ट डोंट टॉक. सो टू एलिसिट हिस्ट्री इज एन आर्ट. दैट इज योर सेवियर.
Wow. Oh, that's scary. Okay.
No, because what happens, अपना see private practice में or we work in a corporation, you all are corporates. So huge difference amongst patients. Even there, my wife was earlier Sion. Sion maybe had Dharavi and Top Hill. Cooper is all SOFO. So she says half of my patients speak English. Yeah. So farak padta hai. They give good history. Yeah. It's all like that, It all depends. But practice is different. But and you have time. Why not take?
Very true.
I may be repetitive, but because they would tell in medical education, tell them what you're going to tell, then tell them what you have told.
Yeah. So, because that's how you remember. That's how the person will remember. Yes. Very true, sir. Very true. So, what essential, as a dental clinic, as a dental setup, how should I be equipped enough to handle these medical emergencies? Okay. Yeah.
And I'll tell you. I would love to answer. See, number one, oxygen should be there. Huh? It is a crime to do even inject LA without oxygen. So what will happen now? So when we started, we would tell कि there is this Goregaon, this place, Rao anesthetics, they give oxygen cylinder. So the question is oxygen. अभी क्या होता है? A lot of my friends say कि वो इसमें मिलता है ना. There is an oxygen small thing, you can buy from the chemist shop. वो या तो placebo है या homeopathy. It has no meaning. So now oxygen cylinder कौन सा? So I'll say D or E type. Very important, D or E type. This can, you can oxygenate a patient 15 liters per minute for half an hour. Important because I have a clinic here and then I want to transfer the patient to a nursing home. It may take half an hour. So वो तो 1 मिनट में निकल जाता है. Number 1, oxygen cylinder with a regulator and at least a nasal prong and a Hudson's mask. सब मिला के 1,200 रुपये भी नहीं होता. Not Hudson's mask is 35 rupees, nasal prongs are 30 rupees. But without oxygen, it's a crime to operate or work. Then, of course, then, and a lot of people, I'll tell you at least, I know of the 50 people having oxygen cylinders. And then you should make somebody risk. For example, in science, the resident doctor, most were responsible to see oxygen khatam hota hai ki nahi, because wo khatam hota hai. And of course, the sister is there. And then we have this mama. Who knows the best khatam hua ki nahi? Mama is a tongue, they hit this thing and they realize, आवाज़ से बोले साहब खत्म हो गया. हमारा डॉक्टर बोलता कितना खत्म आ रहा है ना. So most important, madam. And it's a very famous bio question. Tell one emergency where you don't give oxygen and that is hyperventilation. हर emergency में लगता है. होना ही चाहिए. DE type 600 से आता है. And then Michael forceps. Because you can just go into the pharynx, something falls, if bridge, you can nicely negotiate that area and bring a foreign body out. Magel is very important, number 2. Then number 3 comes, to keep the airway patent. See what they say, eat endotracheal tubes, but simple nahi hai because it's difficult to intubate. So the answer is either a oropharyngeal airway or a nasopharyngeal airway. Again, different colors, different sizes. So pediatric and adult, but are not very costly. And maybe not 150 rupees a set, maybe 200. Very important, God forbid, ज़रूरत नहीं पड़ा, लेकिन you have it. For example, supposing I'll tell, I have a patient, so tongue fell back and I was not able to maintain the airway. So judge बोलेगा आपने क्या किया? I said, first thing I didn't know, I saw the, blood, cyanosis and all. And if I say, no, I had an oropharyngeal airway, I pulled the tongue out. Khatam. It is not that you are supposed to treat the emergency. You start taking care till you refer it to this thing. All of us, for example, if I have an angina, I can stop. But I have to take it to the hospital, and then I should know, आधे घंटे में जाना चाहिए. So you should identify hospitals. So, our juniors, and then protocols in place, and then number, and then I tell them, you ask that physician, कि आपको क्या दवाई चाहिए. तो keep that also in your drug box. So I'll come, so oropharyngeal airway, nasopharyngeal airway. Then masks, nasal, this thing. Suction tube. Suction is very important. हम लोग क्या बोलते हैं कि है ना, powerful suction on the chair. It has no meaning because I'm treating a child, grandfather there has an emergency. So suction 1/4 horsepower, copper motor better because so what होना ही चाहिए, luggable, उतना तो होना चाहिए. And equipment is good enough.
Okay.
Only equipment. I'm talking about drugs.
Okay.
You want me to take drugs also here?
So yes,
continue?
So next, next topic would be how many drugs we should have.
There's something called the Clinical Protection Act. No, they have defined around 15 things, 17 equipments and drugs. वो होना ही चाहिए. Compulsory. नहीं है तो फिर you can be in trouble. So these things are there in that. Yes. One thing, too, I may add there, an ambu bag. Now they have added. Very important, you can ventilate a patient, ambu bag. So ambu bag with a mask, and for pediatric you have 1 and 2 size, 3 for adults. If you're doing pediatric dentistry, दोनों भी रखो. And one thing, we are going a little beyond. It's called automated external defibrillator.
Yes.
Now what happens, see, the best part is I may buy a machine, वो अपन ये कहते हैं ना white bleaching.
Yeah.
So I'll spend 1.5 lakhs, but today it has come down to 78,000 rupees AED.
Okay.
Now what is happening in, for example, I am in Andheri, so maybe 10 of us can buy together one machine and know where it is kept. Like for example, Otters Club, they have this thing AED there, and even they know, everyone knows it's there. So If not, then you should at least know that it is required. Maybe I can give you in writing 10 years down the line, all the dentists will have an AED. More because of Medico-Legal rather than treating. So AED, ये खत्म हो गया. Drugs, most important is adrenaline. Very important. So 1 ml per mg, 1:1000. मांगता ही है. Our teacher will say, Ramban is, Aushad is adrenaline. And then, I can talk, no? So we had this teacher called Dr. Bharenwala. How you were asking him, no? So Bharenwala sir, he was telling he was in KM hospital, surgery resident. He said, I just finished the surgery midnight, and then mama came khat kar raha hai. Bola, साहब चलो, patient is not feeling well, breathless है. तो he is telling कितना breathless है, breath. तो बोला थोड़ा क्या ज़्यादा. तो बोला अभी साहब वो मालूम. तो बोला एक काम करो, उसको बोलो छोटा दे दो. Now छोटा is adrenaline, बड़ा is aminophylline. But they have to give in drip. He said दे दो. He गया, and then he said again he came back. साहब चलो चलो. So what happened, he said, I thought it is asthma, whatever, IG mediated. And he said he had congestive cardiac failure. So from that day, bolta hai, without seeing a patient, I don't even prescribe. So the thing here is, if you don't see the patient, बहुत लोग phone करने गए, दांत दुखता है ये, what should I never show me the patient. You can be in a big trouble. So adrenaline, that's how I always remember adrenaline. Simple hai, but it can be life-threatening. So number 2 is AVIL. That is allergy, this thing asthma, anaphylaxis. AVIL, so 50 milligrams. Could be injectable रखने का. And steroid, उसमें hydrocortisone. 100 or 200 mg चाहिए. So these 3 are चाहिए, is a must. Then you come down to atropine, vagolytic. I'll tell you, once you asked the first question, I'll tell you, मैं थोड़ा ज़्यादा शान है. I would tell my anesthetist, such a nice lady. She is HOD now, Malde madam. She was she's pediatric specialist, but she was in dental theatre. And madam, syncope means, तो बोलेंगे you mean vasovagal, no? So I would think, yeah, vasovagal. And then, फिर बाद में बहुत टाइम के बाद समझा, when I started talking, कि there are, ऐसा नहीं है, syncope could be neurogenic, जो हम करते हैं, cardiogenic, so many, so that is one. And they would always, before surgery, they would always give IV atropine. So it's a preventive. So we can. But what will happen, I have a case, but then when I call a physician, वो बोला बेटा वो atropine दो मेरे को. So atropine is very important. So adrenaline, AVIL, steroid, atropine. Then अपना something like tranexamic acid, वो चाहिए. Hypoglycemia. So what books will tell? Not very severe. आप वो दे दो non-diet cola food. But if loss of sensorium क्या करेंगे? So they will say give IV glucose 25. So the best thing is there is something called as glucagon injection. 1 cc glucagon intramuscular works wonders. वो तो रखना ही है. So glucagon should be there. And tranexamic मैं आपको बोला. So by and large this will, so we have to take care of cardiac, respiratory, bleeding. इतना तो minimum चाहता है. And if I remember, I may, if I remember, I'll tell you, but I'll add to the list. But these are 3 things. So adrenaline, AVIL, तो by heart होना चाहिए, कितना और कैसा. And again, make one assistant responsible to check the box. Because the expiration date we ignore, and then you will be in big trouble. So वो एक important है. So you have to have a crash card in short.
Yes. So even staff should be, I think, well trained, sir.
I mean, all of us say, but books say have mock drills. So for example, something goes wrong in my clinic. So I will have Dr. X calling the emergency. And this 801 and all 108 works beautifully. They come, or 112, and then nursing home. Then somebody will come. For example, I'll tell you another Sion hospital. Initially, when there would be syncope and all, so we were just trying to manage. Believe me, I will cross my heart and say, we had this Maushi, in the Maushis, Puri Ben, and we had a mama called Sharad Mama. Immediately they would rush and keep the stretcher ready. See, I was lucky because science something goes wrong, you can lug the patient to the casualty or medicine or so they would be ready. So that should be the kind of,
Yeah, support from the
yes.
staff.
So,
Yeah.
Somebody calling this thing, somebody getting you the crash card, somebody, if you have an AED, he'll get an AED, call for help. वो सब होता है, but training important.
Nowadays, I think implants are so common that implant surgeries do keep happening day in and day out in all the clinics. So what is what are the the emergencies remain the same for everything, or is there some kind of emergencies that have become very peculiar while implant surgery is going on?
I'll tell you, very simple. So basically you're trying to tell me there's a minor surgery and major surgery.
Yeah.
The answer is very simple. There is nothing like minor surgery. There are only minor surgeons.
So there are nothing called as minor
we should be ready.
surgeries.
For example, innocuous, they say innocuous looking tooth, you remove and it starts bleeding. बंद नहीं हो रहा है. अरे बोला, it was a mobile tooth. So see, that time we didn't realize कि that could be granuloma or it could be a CA which is sitting, So हिलता हुआ दांत रात में, and then pray and pressure, बाबा खून बंद होना चाहिए. It's like this. And there are only minor surgeons. Never. Implant वाले तो बहुत but कभी something goes wrong and then you had it. Never take anything lightly. Be prepared for emergency drugs, equipments, training, and as you said rightly, train your staff. Mock drills, have protocol in place. The best thing is to stick the number here of the. I think you said next to some maternity home, so you at least you have a hospital next door.
Yes, right.
So you know where to take. And then उसको पूछो आपको क्या लगेगा. They never say no. तो बोले मैडम ये रखो आपके पास. It's always nice. So identify hospital, and I tell during all my lectures, all the girls who are not married, please marry a physician, and then see that he has an AED. It's like this.
True.
Very important because अपना हमारा time चला. I'll tell you. When I did MDS, there would be this. Last paper was essay.
Yeah.
So one famous thing was cardiac arrest. हमने लिख के आया 3 घंटा, लेकिन कुछ नहीं वाला उसके बारे में that time. But it's no more now, So what's happening is, I may talk bookish ki longevity. See, 1937, 30.2 years was the life expectancy. Today, it is around 68. 2030 it will be around 80. So growing population. Once I am old, I'll have a stent here, I may have a transplanted kidney. So medically compromised anyways. And they may not tell also because kya dentist हुआ था so second thing. So you may just end up in an emergency. You will not know what अभी खत्म होगा सब. So it was not like that before. मालूम थोड़ा blood pressure, diabetes ये करो छोड़ दो ऐसा. And then I don't know. I'll just tell you how. I did off this thing. I was doing MDS. So my guide was my dean, Dr. Wadkar sir, and I knew he would always come at 1:30. Round लेते थे. Dean has no time, and that time I would always be there. Like this. So he would in fact tell he is the only sincere person. ये हमेशा रहता है. So one day I thought I will impress my. So there was a fracture mandible case. उसको बिठा करके जान बुझ के till sir came and then I was examining. So he said, "Wow, very good. What is?" बोला sir fracture mandible. सब बोला sir ये है occlusion this. Very good बोला. Any medical history बोला? No sir, not at all. Okay. Then ask him whether difficulty in micturition हो गई. सर चले गए. मैं उसको पूछा बोला हाँ सर पेशाब में तकलीफ होता है जलता भी है. मैं सर के भाग के गया. बोला सर आपको कैसे मालूम? He said अरे you told me right now no. So he said, go and see his feet, see the edema.
Okay.
So, they would tell us, our teachers,
Examination.
the entire patient. So, इधर आके side में थोड़ा सुधर गया. So, ऐसा था. But slowly, so that's how we grew.
Yeah.
And juniors should know, because, unless you see certain... Here तो side में कैसा था, we would operate. And we had a common surgical recovery. तो आपने patient रखा तो उधर वो, they are giving CPCR. तो वो एटमॉस्फेयर तो आस्ते आस्ते आ जाता है. So that's why I say any oral surgeon should, even the dental council now says is it should be at least 6 months casualty posting and 3 months ENT in surgery.
Okay.
then you get your degree. Slowly आ जाएगा. It is more for rural surgeon, but then even if you're doing an implant, nothing is a concession.
Nothing is minor surgery.
Nothing
Everything is major.
It is. आप सोचो ना, supposing it's say my wife and I want to do an implant, मैं सब ready रखूँगा.
Definitely.
Everything.
Definitely.
So my teacher will tell, like, patient on the chair means do whatever you have done for your relatives. You'll never fail.
That is so true. Going ahead, sir, from here, that patients who are on cardiac medicines, like after their angioplasty, what do you suggest? Like those people who have stents and they have heavy ecosprints and blood thinners going on, antiplatelet drugs. So all these history now the protocol is little different. So I want to know the recent protocol, whatever is going on recently for basic extraction or implant surgery.
It's very important thing again. So I'll tell you, the thing is, we need to differentiate between anticoagulants and antiplatelets. वो दो चीज़ आ गया. So antiplatelets is basically aspirin, clopidogrel. I'm talking about chota. And there you have heparin, warfarin. Now that is given for for example, if you have a valve here और डीप इन थ्रोम्बोसिस, तो उतने पेशेंट अपन प्रैक्टिस में शायद नहीं देखते. इफ यू देयर वेल वेयर विल गिव सो यू विल गिव योर टू प्रिवेंट एसबी एंड ऑल. वी गेट लॉट ऑफ पेशेंट्स टुडे हु आर ऑन एस्पिरिन क्लोपिडोग्रेल. सो एंड आई रिमेंबर वी हैड दिस डॉक्टर साने सर. ही वाज सेंट जॉर्जेस सर्जन, ऑनररी यूनिटी सर्जन. ही वाज अ लॉयर. So he made a statement at least 40 years back that any surgery on head and neck should not be done without doing CBC, BTCT, urine, routine and microscopy. इतना तो करना ही है. This includes extraction also. Now every case that is done in MGM Dental College, they take this and they do a BP and one more. This is they do for every patient for extraction. So I'll come back. So now history. If you go to see, if you focus, so most of them are aspirin, clopidogrel. The best thing, see what they will say, there are a lot of platelet, PT, PTTK. The best thing is to do an INR. Okay. INR से क्या होता है? Basically it's a normalized ratio. Now one represents a normal. So if I am normal, one is that I am normal, nothing wrong with me. So earlier they would say around 2.5 INR. आप करो operate, you can do. Beyond that, no. So the recent thing what they say is no. Till 3.5 you are supposed to also, I'll simple extract. The reason is, madam, I have a INR of 3.5. I'll say I will not extract. So what I'll do, I'll send him to a cardiologist or a physician. What they will tell see, tooth is not that important. Patient's life is. I don't want that anticoagulant happening here. You go to hell. So now even our books say, American Heart and American Dental, they say no. 3.5 tak karo. Do something locally. So whatever you can put it, and give a nice suture. So the recent thing is 3.5 tak kar sakte hain legally, and it does stop. Okay. There, if you want to discontinue, I'm talking about heparin, then what they do is they admit the patient, put on low molecular weight heparin. And then they keep on seeing that. But then that is most of admission and valves and all. Antiplatelets, INR, 3.5, bindas nikalo. But you should know. So whatever you do, gel or whatever. Bone water should, and at night, हम लोग सब सूचर डालते हैं. That is NKW is GDC word. It's called नाम के वास्ते. It has, that the mucosa should appear pale. What's happening is you are going to now compress the mucosa over the underlying bone. Then only the capillary bleeding, so it stops.
Yeah.
So that is the recent thing.
Okay.
And of course, they keep on changing, but this is good enough.
Super. So that goes to the cardiac thing. Now, any other history patients giving,
See,
what is
if you could, so we have done. So cardiac mein, one is say bleeding ho gaya. Hypertension mein what happens, so that equipment, BP machine is very important. And then baseline is very important. उसमें भी होता है कि cuff size is very important. Then where to put the cuff, how tight. So BP लेने का. By and large, they know, they'll tell you. There's only one emergency if the systolic is say 180, diastolic 120. Now, ऐसा होता है clinic में. So what they say, it could be a hypertensive emergency or urgency. Urgency is, I'm not knowledge, this is one should know. Urgency is you don't have a secondary, organ damage. What is an organ damage? Primary, so retina, heart, brain. ऐसा रहा तो that patient should be shifted to a nursing home. He may or may not have, but you are supposed, and they start in IV or intramuscular to bring the BP down by at least 20 and 10. So BP measure 180, 120 normally करने नहीं चाहिए, होता है अपन करते भी नहीं है, but हुआ तो लेना चाहिए. So that is blood pressure. Now cardiac में there's something called angina. So I'll just give. We have time, no? So this we have this say cardiac vessel. So it's left anterior descending. Now what happens as we grow? So when I'm 40, I'll get some gray hair and some knee pain. So even that lumen of the artery slowly gets occluded. What's happening is, athere comes. So athere is lipids becoming heart sclerosis. So it will come and start. So lipids, they get calcified and then start occluding the lumen. What will happen? A time will come when it is 40%. When I'm doing some exercise, for example, if I'm on the second floor, when I come now, I'll get pain, substernal, could be radiating to left, right arm, jaw, angina, but stable, because once I come, sit down, it goes away, it's good, no problem at all. More than that, rest, pain not going down means unstable angina. Now these two things may be stable, you can treat, but then as you said, so we'll add one more drug to this thing now, glyceryl trinitrate, nitroglycerin. उसमें एक spray भी आता है, summer, beautiful. So it goes over below the tongue. So I'm on second floor, patient comes, बोले साहब दुखता है. Why should I take a chance? I can give a nitroglycerin. One puff, 0.4 mg, and if no pain, I'm happy. Now if this is occluding the vessels totally, the muscles will die. So infarction. So there, I give one puff, 5 minutes second, one third puff every 5 minutes, pain not going down, it should be an impending myocardial infarction. So again, should know, so again history, see the patient and try and this thing. And it's a very thin line. And all of us, every day you paper, child, school, exercise, die.
The age has also come down tremendously.
Post this thing, you will never know. And they say, books say that these things keep on happening every day. It's going to happen in a clinic also. It may happen. True. It's like this. So that was so infarction, MI is good enough. Then CNS, madam, Syncope, most important but most neglected. So we'll come to see basically what you can make out. Basically phase 1, phase 2. So clinic, doctor sahab, equipment, garmi. So I start throwing catecholamines. So initially what will happen, my body will try to, so initially that could be peripheral resistance. So blood pressure may go up, pallid is rahega, I may not feel well, and classical, that butterflies in stomach, they say, merry-go-round niche aate na, that classical feeling rehta hai. And then sweating, you can make out. Usi time agar aap head low karo na, it can be taken care of. If not, then blood goes into the major muscles, cerebral hypoxia, syncope. But we are known, so head low kiya, it is taken care of. But syncope lasting for more than 5 minutes, think of some other cause, and then take an opinion. So, it's very simple, but most dangerous. And it should be neurogenic, everywhere. But I'm not trying to, but you have to be careful in each and every case. So, and stroke. Again, abhi bahut common ho gaya. All of us know, no? So, very simple thing is, supposing patient is on my chair, I'm talking to the patient. That's what they say, should observe. Now, suddenly I find he's not speaking properly now, number one. Number two, probably he's either staring or he's having some sort of diplopia. So what I'll do, aisa hua na, to I should suspect stroke. Best thing is I'll make him stand up, ask him to close his eyes, and then put the both arms. What will happen? Slowly, one arm comes down. I'm not speaking well because stroke here, the soft palate, tongue are also not. So dysarthria, lazy arm, and maybe a diplopia. Immediate 1 minute you can diagnose, and why you should refer immediately, because earlier what would happen when I did my MDS, infarction, wait for 6 months. Whatever damage will happen. I said, abhi nahi na. From my clinic to the cardiologist, half an hour they put streptokinase, 1 hour they may put a stent. Patient is as normal as before. So now a lot of people are putting stents for strokes here. Can be prevented. So dysarthria, lazy arm, diplopia, and malum padta hai. Now it's not many of us see so many, so we may not. But then all these things can happen. So this is syncope, stroke. We should know. Then asthma, all of us know. Classical, but he will tell you. So अपन ने अभी क्या रखना अपने kit में? That salbutamol spray. And what they say, keep with a spacer. Again, spacer is around 35-40 rupees. It works well. And foreign body, sometimes working bridge goes down, obstruction. Classical है. उसमें what they say is, if I'm doing like this, this is a universal choking sign. For example, हमने डाला bridge मिल रहा है नहीं मिल रहा है, when you're looking for the area around the chair, and it is now sitting on the vocal cords. If it goes on the right lung, ठीक है, because then what? So if he does this and is not able to speak, then that hemorrhage. तो वो important है. And नहीं हुआ तो if I've done that. मेरा एक दांत गया है, मेरा एक रीमर गया है. I've done. So X-rays, abdomen, neck, lateral, AP, and then feet. So that time when my rimor had gone, that's why I said Dr. Desai. So I thought patient ने वो उसमें गया, रेस्पिरेटरी में गया होगा. So चिट्टे सर थे, बोले नहीं ऐसा नहीं है. Desai sir से बात करेंगे. Sir said no problem. They were nice. My teachers were, don't worry, take the patient to St. George's, admit करेंगे. तो उधर एक डॉक्टर शाह करके थे. He had just finished his surgery. He's a pediatric surgeon now. His sister-in-law is a oral surgeon. तो बोले पारेख, तो बोले हम ऑपरेट करते ना. तो I came here, sir. Desai sir said nothing doing. So he talked to his boss called Dr. F.F. Chhatri वाला. So see now हमारे टाइम पे ही आता था तो एडमिट करने का and only banana diet. Yes. And then you take X-rays and every day morning we would sieve the stools. Second, third day में निकला. And today it's very simple. Scope 2 minute में बाहर आ जाता है. Things are, but the thing is you should expect, you should know where to take and what to do. And Medico-Legally, if I lose a rimor in the patient's GI tract, I'm going to pay, the dentist will pay to take the patient to the hospital and for the entire procedure. ये legally ऐसा है. So that was asthma, foreign body. Then what else? By and large, or if I remember. So by and large, so basically now it's diabetes. Diabetes blood pressure हो गया ना तो काफ़ी चीज़ हो जाता है. And you said rightly, clopidogrel aspirin INR हो गया तो काफ़ी चीज़ हो जाता है.
Covers up a lot.
And क्या था? Diabetes. Very important now, but we have already spoken. So 3 phases. Initially क्या है? Sweating, all those things, not feeling well. And second is glucagon, but it works beautifully. And one thing, that we talked about angina. See what happens, madam? This pain, so we said substernal radiation, right, left arm, jaw. Sometimes the pain is in the epigastric region. Yes. So, अपने कैसे रहेगा? मक्का खल्ला रात्रि हम करें. So, but the thing is, and I'll have a study, Sion Hospital, they say that pain, to differentiate whether it is cardiac or GI, you need to take a ECG. Only then you come to know. So ऐसा कुछ हुआ ना, it's better to also take a medical reference. Okay. Because most of the time it is missed.
Yes. Because I mean, if the patient points out here, it's mostly epigastric,
typical
something you must have eaten.
खाया, मिर्ची खाता है ना. We try to find जितना और जब तक इधर से निकल जाए बाहर बाद में देखता हूँ क्या करना है. Typical of us.
True. So post COVID, COVID has compromised a lot of immunity from a lot of people. So post-COVID, are there anything in peculiar that you are seeing a lot? And during COVID, how was your experience in Sion Hospital?
I'll
Like
tell
if you can just share.
So we never, the hospital was almost shut. I'll
Yeah.
tell you, probably, again, it's like show off. The first paper, there's one Dr. Hera Havewala. Her mother was a dentist. We lost her. First ever case on oral, findings in COVID patient. This girl, I'll tell you, I salute her. She would go with all those things, and to the ward and do. Now, most of them were mostly ulcers and maybe a little tongue coating. Extra kuch mila nahi. But after that, the number of mucormycosis, and then it is हमारे में से जरूरी नहीं. It was most in the ENT, opthal, because you have to go. And हम लोग तो फिर जाके खाली help करते हैं. You know what happened? You'll have a mobile maxilla, so they would call us. But that was very bad. And हमने मंगता उतना देखा. But it also got controlled very well. But the entire thing credit goes to the ENT and ophthal guys. Because we would not know अभी ये देना है that anti-actinomyces drug वगैरह they would do. It was there. But after that, once that was over, no, in clinics no, stroke बहुत होता है. So I would be very cautious about patient young also getting a stroke. Because if you remember the earlier postmortem findings abroad was intravascular clotting. So it will lead to all these things, So that was one. But like I had a friend called Dr. Shah. He was HOD of he would say, till there is herd immunity, ye hone wala. And today it's there. People who did not take vaccine, they are more happy. No, I'm telling you.
True.
They was, I know so many. Because you may not know. So bleeding diathesis, stroke. अभी लेकिन almost normal हो गया है. We forgotten also.
Okay.
It was quite bad.
That is a very.
Because I have lost my mother-in-law. He was in Seven Hills. I'm so bad, but.
Yeah. Okay. So any specific event that has been with you till date, like any specific case or any specific patient that you encountered?
See now I joined Sion Hospital, and somebody phoned me from Panvel. But I'm sending a patient, abscess है. तो मेरे को लगा, see now I am that बड़ा doctor, isn't it? वो बोला we have treated him. He is being sent from a surgical nursing home. एकदम बोला मस्त अभी अपना हो गया. And then this lady was there. She had a ulcer here. The history was she had third molar, infected, abscess. So the dentist did nothing. He took her to a general surgeon, admitted, and they did an IND. But what would happen? This ulcer would not heal, and it was spreading now. So अभी बढ़ रहा है. फिर अभी मैं बोला अभी इसका क्या है? अभी तो हो गया. Then now wife of a PWD engineer, government of Maharashtra. Now I'm telling how like. Now there is this young man again, he said अपन एक random blood sugar करते हैं ना, तो 340 or something. Okay. And then it something called as cervicofacial necrotizing fasciitis, it would just grow. And we would so admitted, so they would just debride it from here, it came to all of the chest, she died. So like anything can happen.
Yeah, nothing, it's unpredictable.
So that has stayed here, So every time I talk, I show that picture. So again, इधर आना चाहिए कि do random sugar at least. People अभी आप सी थर्ड बोलर को आए ना बोलेंगे तो नहीं करते हैं because that's another सब खर्चा for them, And मैं नया ओरल सर्जन है, मेरे को जैसल मैडम ने बुलाया है, सेट चलो मैडम 500 रुपये दे दो, मैं निकालता हूँ, वो सब नहीं करने का. So that has stayed because then from that time we become very serious. It's simple नहीं है ऐसा.
Precaution is always better than cure.
And that forward thinking.
Yeah.
See, that you learn only either when you see, for example, they say now you said 47% dentist, this is a study proper, keep emergency medicines and equipment, 67 are trained %, but उसमें क्या, the senior most are capable and able to handle emergencies. It's a beautiful study from Dr. in Pune. And but UK, USA, Canada, Australia, they say there is need to be revised training. And Australia, they bol rahe baba, they're totally. I've just, I thought you may ask. So training is not sufficient. Revised training. And as you said rightly, madam, every 2 years you have to keep on learning.
Yeah, rather than updating, it's just something.
Yeah, and you have a piece of paper that protects you in a court of law.
Yeah.
It's like this.
So this, we've mentioned again and again about this medico-legal thing. Let's just give our audience an introduction.
Okay. I would love to.
Just small introduction.
Yeah, I would
because
love to.
I want to plan a very big episode as we discussed before. So just an introduction that.
I will love to.
Yeah. So the dentists actually come under Consumer Protection Act. And for that, what are certain things that all the dentists should know, should be aware of? And like, have you seen any increase in medico-legal thing for dentists in the recent times?
There is, for sure.
Yeah.
For sure, because what happens, I was president, ID state. So it's not a statutory post, but when the case comes to the MSDC, you are also called. So first thing is we come under CPA, yes, but we can also be tried in the civil court. It's called torts or a criminal court. For example, I'm doing a third molar and I fracture the mandible. It becomes criminal negligence. Okay. So I'll start with, I cannot say that मैं train में बैठा because I didn't know मेरे को ticket खरीदना है. So I should know the law. You said short. So law, ethics. Now, we'll take an example. For example, a patient comes to me for third molar. Okay. So he comes, then he opens the mouth. So now this is an implied consent. वो दे रहा है मेरे को. So I may not take a consent, but I'm doing an examination. After that, I tell him कि ठीक है ये निकालना पड़ेगा. So now I'm entering into a contract. So contract आए कि consent आए गया. Now consent में वो सब history and all, but consent में what is the procedure, what can be the complications, what can happen if you don't do, and what are the alternatives. For example, there's a beautiful paper from Naya Dental, they say coronectomy. So they would just remove the crown and leave the roots. So you could buy time. So I need to tell him also. हमको क्या अभी बाइकों ने बोला शाम को सब्जी लेके आना है तो बोला नहीं इसको निकालना पड़ेगा ना कैंसर हो जाएगा all those things. So alternatives. And then so now you have 3 assistants. Don't leave it to the junior most. The senior most should take the consent, same pen, all the papers signed and dated, and same better. See what happens, judge बोलेगा अरे ये पेन अलग तो आपने बाद में शायद ऐड किया होगा. Why, judges are very smart people. So that is one thing. अभी consent का then age होता है 18. Sound mind, if he is of unsound mind, you cannot, and a child. Now, if there's a patient who is unconscious, just come to me, and then say bilateral fracture mandible symphysis going, so I need to treat. So I may just without consent also do a case. Now, what will happen here, if I'm in hospital, the AMO may give a consent because he is there, we call it, the person who is in charge of the patient till he is unconscious. That can be done. And fourth thing is, if you're doing a surgery, if you need anesthesia, different consent for anesthesia. And if you're doing an implant, say for a hemophilia patient, if it may require blood, one consent for this thing also. So now third molar has come to me, consent sign ho gaya. Then the 4 Ds. Now I have a duty to perform, to operate. Then that could be duty ka dereliction. So I'm doing a third molar, something goes wrong and the patient develops a tongue paresthesia. Okay. Then he may go to the court of law. He will try to prove that I did not protect the lingual flap with I may have taken a consent with a retractor. So there should be a direct cause, proximate cause. And finally damages. So as I said, mostly pecuniary, they take money and they settle down. फ्रैक्चर मैंडिबल हुआ और इफ आई एम रॉन्ग टूथ ओनली तो वो तो कोर्ट में तो जज भी पूछेगा नहीं आपने दांत तो वो गया. सो दैट गोज इन क्रिमिनल. सो नाउ CPA, वाई? बिकॉज CPA अर्लियर वॉज डिफिकल्ट बिकॉज पेशेंट हैड टू गो टू द CPA, गिव एन एप्लीकेशन. अभी मैडम यू कैन सिट एट होम and sue me for 1 crore, 10 crore of rupees. So that's why CPA. So consent, who can take what, and then if he refuses, refusal consent what should be taken. And agar ye sab hua, fir bhi he is proving that I was not doing, so it's called standard of care. What will happen? So you know that Dhusia not protecting the lingual nerve is, you know, loss of, something wrong with the standard of care. Negligence kaise aata hai? What you will say ki normally in Mumbai, a person who is similarly trained would have done this. He has not done this. तो उसके लिए वो sue करेगा आपको. Negligence because there was no standard of care. Now what happens, you know, I remember my teacher Dr. Lele sir telling us when we were in third BDS that oral surgeons in Nagpur would operate on tonsils also. But उस time ठीक था because there was no ENT surgeons. Okay. So they would operate in same area, no? Like today they have allowed oral surgeons to do hair transplant. Yes. So no, things keep on changing. But standard of care उसके लिए होता है. And then finally जो आपको लगा either, so you know, CPA they are very bad. You know, they feel they have lot of deep pockets and they, so CPA and then finally prevention. You know, best thing is to prevent. No, ये करने का नहीं, consent लेने का, उल्टा बात करने का नहीं. You know, be nice to the patient. Most of them इतना खड़ूस था. You know, all those things time में दिया नहीं. It's like this, you know.
So that's just an introduction. We'll take this topic ahead with the second year for sure, sir. So
I'll repeat again what my friend Dr. Pranay says. 473 cases as of now, and every case is, you know, it's a nightmare. It's, you know, it's horrible. Just imagine you're in a party and you're thinking of that case happening. You know, all those things. And we need to be now more educated in Medico-Legal.
So do we have a strict consent forms, like a formatted consent forms anywhere available? So
I'll tell you what. So see what happens. What the law says, you cannot have a standardized form. It cannot be. Even for a third molar, for you and me, it could be different. So the best thing what they say is have a specific consent forms. The best. That's what the code says. Otherwise, IDA has consent forms. It's available for some, so for root canals, endo-prosthetic works and all. But ऐसा होना नहीं चाहिए. I think the best part is you make your own. And as I told, customize. I told you before, go through some books and make your own. Judges will never, you know, अगर आपका consent form name लिखा है आपने ऐड किया तो बोले they don't take it. See, they are just against. तो बोले this ये तो क्या है? Specific किधर है? What's wrong in that?
So it has to be patient specific, not clinic specific.
Patient specific rather than treatment specific. What happened?
Yes.
Say third molar आया and I have osteoporosis also. तब क्या? So then you're going to add no. For example, when you take high risk consent, they take in fact high risk consent में आपने लिखना था including death on chair. Okay. हो या नहीं? So very important. And so I feel we should make our own nice consent forms and don't make खाली अपना नाम भरने का नहीं, patient's name, this. What? And also alternative this thing, treatment plan. And if he refuses, consent भी लेके अच्छे से clip to the patient's paper, because the judge will say what was not recorded never happened.
Yeah. So you can have a form of medical history, dental history, plus a consent form which is customized.
Yes.
I think that's the best way to be prepared from your end. That's the best thing. Perfect, sir. So we come to an end to this podcast, but any advice or any tips for general dentists out there, like, you know, you would like to add on after at the, like, you know, you would want to conclude with?
No, as I told you, it can happen, emergency can happen suddenly to anybody. So, I'm repeating book. You should know to diagnose, prevent, and be prepared to treat. Yes. Most important, nahi to you're inviting a medico-legal problem. Simple. And it can happen to anybody, anywhere. We put a cross down car mein lagate hain na, but that is for the people to know this person is not trained. Apan to bhag jate hain. So be prepared. And I know a lot of people, for example, I'll just conclude myself. I'm taking names because myself, there is one Dr. Sharif Firoz, Dr. Meshram sir, my teacher, Dr. Das, and one Dr. Vora. We were traveling in plane. And then there's an announcement ki any doctor on board. Abhi in log mein chabi laga diya. Dhusia, ja tu. And then there was this girl, and she was almost unconscious, not feeling well. ऐसा saliva running. So क्या करने का? And then there in the same plane there was a resident in surgery from KM. Okay. His father was the gynecologist and his mother who was a dentist also was there. But they were, so अभी क्या कर? So we went there. मेरे को लगा कि probably syncope है. And she was answering but तो क्या करना? So हम लोग कर रहे ठीक है ना? As that this thing. This I have pictures to show. Oxygen है बोले तो then we gave oxygen sure. But then she is asking me. पायलट पूछ रहे हैं कि वेदर वी कैन गो टिल नागपुर और वी हैव टू जस्ट टेक दिस थिंग. अभी उसको कैसा करने का? सो भगवान का नाम ले आई डोंट नो शी इज फाइन बिकॉज शी वाज ओके एंड देन इट वाज सिंकोपी ओनली एंड शी हैड नॉट ईटन ऑल्सो. So that I always mention it can come to anybody. Either be prepared ना तो चुप बैठने का. There's a lot of reels dentist जाके आता फिर चला जाए ऐसा कुछ नहीं. There is a good Samaritan law. If you try and treat an emergency, nobody can take you to the court of law because it is in your interest. So that good Samaritan law will always protect you. Okay. Never worry about that. Okay. So I thought
great. Thank you so much,
thank
sir.
You.
Thank you
God
so
bless
much.
You.
And it was an honor to host you. And I'm sure we are coming back in I'm planning a season 2 with 2 guests at a time, and what we discussed before, we are coming back to this topic called as Medico-Legal whenever we plan next, and it was amazing, sir.
If you don't call me, I have a friend who was a high court judge. Now he's left very big, very 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 big man. I can you can take a court of law.
You definitely come.
Then we'll settle outside. Karega. He will end up giving me 1 or 2 crore rupees. No, I would love to because that is this thing, and I would love to.
Yeah, thank you so much.
Thank
sir.
you.
Thank
God
you,
bless
sir.
you.